Hello, everybody. So, today is 4 days post-op from my procedure. I'm sharing this. So, the dentist that worked on me actually encouraged me to keep kind of a documentation on my progress with this procedure because there were so many health concerns overall with me that we both were very interested to see how this procedure would actually affect my health, not just my smile, even though I love my new smile. I really do. And as my facial structure comes back to normal and my gums go back to normal and the denture really starts to settle in and it gets relined and adjusted as I go, I'm going to love my smile even more. And I'll be honest, you guys, this is the first time, I think, in my entire life that I can actually smile with confidence and actually like the way I look when I smile. The teeth are great. I can't wait until everything fits securely because it does affect my speech right now. Again, it's only been 4 days. You can already see that the shape of my face is returning. My nose is shrinking. You know, everything is kind of going back to normal, even though I still have quite extensive bruising down around the bottom jaw. I went in for my post-op appointment today, and the dentist actually told me, she said, some of those teeth on the bottom were really, really hard to get out. They removed over 20 teeth that were root canaled, and then 6 natural teeth were removed. The reason we're kind of documenting to see the state of my health as I go through this is because I was suffering for years with every type of autoimmune symptom that you can imagine: chronic fatigue, chronic inflammation, pain in my joints, brain fog, emotional instability, anxiety, depression. I mean, you name it. I was suffering all of these symptoms, not to mention constant breakouts and rashes on my face, interesting internal things that were going on, excruciating pain located either in or around my organs at times, through my heart, my kidneys, my pelvis area. It was just always something. And I never felt well. Never. Even on my best days, I never felt well. So we really wanted to see if it was a possibility. Now, I was more concerned, and I brought it to her attention, and she agreed with me. She said, what you're talking about is not unrealistic. It's a very real thing. I'm very sensitive to a lot of things, and one of those things is metals. In dental work, they commonly use a lot of cheap metals like copper and nickel. These tend to be very, they're cheap metals and they cause a lot of allergies. I am allergic to those types of metals. I even have a hard time with sterling silver, if I'm being honest with you. That's why you never see me wearing a lot of jewelry, because if I wear it in my ears swell up. I actually ended up taking my nose ring out last year because I thought maybe that was the cause of my nose constantly breaking out. Just all kinds of weird things. But anyways, those 20 plus teeth in my mouth that were root canaled were actually the equivalent of leaving a gangrenous finger on your hand. When we have dead body tissue, we remove it because it causes issues with the rest of our body. When you root canal your teeth, you're leaving dead tissue in your mouth. And then we pack it full of heavy metals and cheap metals, and then we call it a day. Well, what happens over time, and it usually takes about 10 years to really start degrading in your system, is that those metals, they start to erode and they start to break down in your system and they start to leach into your body. So my root canals were nearly 30 years old. Okay, they were very old root canals. So I had exposed metal in my mouth. When I would smile, you would see that dark ridge near my gum line. I was getting, my natural teeth were starting to break because I was missing teeth. I just had a lot of issues in my mouth. And one of the biggest concerns for my dentist was the fact that I had 8 active cavitations in my mouth. These are deep infections under your root canals, under your natural teeth, that seep into your blood every day, along with those heavy metals. So I'm being just basically bathed in toxins every day. And we're starting to get a picture of why I never felt well. So the procedure was on Friday. The dentist was amazing. Amazing. She was so fantastic. And I'm so glad that God led me back to her, because I almost went someplace else. But God said, nope, I got other plans. So he brought me back to her. And I'm really glad that he did. She did a fantastic job taking my teeth out. She did a procedure called troughing, which is less traumatic, believe it or not. It's less traumatic to the bone. I can't even imagine what I would look like if she had just gone in there and just started ripping my teeth out. But troughing is actually the sectioning of your teeth so that they come out more peacefully. So she did that on all my back teeth. She did troughing. The first night was really bad, and I never regretted doing it. But the first night was really hard to get through. There was a lot of blood. It didn't look like it was slowing down, so that concerned me. But I just took my meds, just went to sleep, tried to stay calm about it. The next day, the blood started to dry up, and it started to, just here and there. The teeth felt so weird. It felt like I had a foot in my mouth, but that's lessening as the swelling is going down. And then I think yesterday was probably my worst day. I had a lot of jaw pain, gum pain, a lot of gum pain. So the dentures were moving a lot. They weren't lining up right, and I still have all this swelling inside the cheeks. So when I'm trying to, clench my mouth down, it's getting the cheeks on the side. That's a lot less today too. But, one thing that I will say is I wish I would have been a little bit more proactive in getting all my aftercare instructions before they sedated me, because I left on Friday with no aftercare instructions. Had to rely on ChatGPT just to get through the weekend, because I had no idea to clean them. I had no idea was I allowed to take them out of my mouth. I didn't know what exactly to do. So I ended up having to go to ChatGPT for that. So that was just a miscommunication or a failed communication on both of our parts. But today I will say that I am noticing some things, and I don't want to jump the gun, and I don't want to sound crazy or anything. But when I get up from a chair now, I get up from a chair and I just walk across the room. I don't have to take 30 seconds to stretch out my back. I don't have pain in my hip. I don't have pain in my back. My sinuses are clear, and I'm able to breathe through my nose. I don't have any pain in my body anywhere. And so obviously it's only been 4 days. I'm not going to jump the gun on that one, and I'm going to keep documenting my progress, because I think it's very interesting that, first off, no pain. But second off, I have so much to talk about today. Like, I have so many things on my mind, and usually, especially I think within the last year and a half, 2 years, I've kind of shut down as far as communication goes. I don't even like to talk anymore because I'm constantly forgetting what I'm talking about. I can't articulate what I'm talking about. The brain fog was so bad, you guys. You have no idea. And it just completely shuts you down and shuts you up. You can't argue about things. I can't even write a letter to somebody without sending it through ChatGPT and say, can you make this sound like a human being wrote it? Because I can't think clearly. Well, I can now, but I couldn't think clearly. And when you can't think clearly, it makes you very self-conscious about what you open your mouth up to say, because the words just don't come to you, you know? So that's all starting to return too. And I have been taking a biotoxin binder by Cellcore for about, I want to say it's been about 3 weeks now that I started taking that. And I'm taking it now too to just kind of mop up if any heavy metals, escape the system basically when they were taking the teeth out. So I have been taking it now as well. But I'm noticing that brain fog going away too. So that's really interesting. So I have so many things to talk about today. I went to Marco Polo with my friend today, and I think my message was like 20 minutes long because I just kept going and going and going, and I've got all this stuff going on in my head, and I want to talk about it now because I can. So that's kind of exciting. She said all this bruising and stuff, it should go away. You might still see bruising, she said, at 2 weeks. You just never know. Everybody heals a little bit differently, but swelling and bruising is just part of the game. She said if you already feel this good at 4 days, you're going to feel amazing at a month. You're going to feel even better than that at 2 months. And I'm just like thinking to myself, this is awesome. Like just last week, I felt like I couldn't even go on another day. That's literally how I felt. I literally just sent in a disability packet because I'm in so much pain. You have no idea how much it took to even get up and go to work. And that same pain that's been there every single day since 2008, it really started. Right? It's gotten really bad in the last 5 years, but it started in 2008. I've been dealing with this since 2008. And in fact, in 2012, the pain was so severe that I walked with a cane for 6 months. I had to walk with a cane because I was in so much pain. So my advice to you, if you are struggling and you don't feel well, and this is a blanket video. I'm making this for my family, my friends, and everybody out there on YouTube who happens to stumble across this video. If you don't feel well, and every time you go to the doctor and they run tests on you, and they tell you that you're fine, nothing's wrong with you, I urge you to do 3 things. Get them to test you for parasites. Get them to test you for mold, and get them to test you for heavy metals. Okay? They don't test for these things, and I don't know why. I don't know if the testing's just too expensive. I don't know if I don't know if they think it's all witch doctory. I don't know. I don't know what their reasons for, but I can tell you that more people than not are suffering because of heavy metals, molds, and parasites in their bodies. And I think that that's why my health has gotten so much worse in the last 5 years. Because from the day I stepped foot in Tennessee, my health has gone completely downhill. I think I'm exposed to a level of mold here that's just beyond my wildest imaginations. And I think it affects me really badly. Some people feel like mold doesn't affect them. I beg to differ. I think it affects everybody. You just don't realize that that's what it is. So, anyways, if you're having issues like that and you're not getting a diagnosis, right? Like I went into the doctor, I had every single symptom of lupus. But they didn't diagnose me with lupus. In fact, they told me I didn't even have an autoimmune disease. Well, if I don't have an autoimmune disease, then why is my body attacking itself? It just doesn't make any sense. And it doesn't make any sense because they're not bringing every piece of the puzzle to the table. I don't know if they do it deliberately or if they do it, like ignorantly. I don't know. But all I'm saying is this is the end of the road for me. This is where all of my travels has brought me, to here. Right? Getting these teeth out of my mouth, getting that infection gone, getting those metals gone. And I'm obviously onto something because I already feel better. 4 days post-op, I should be feeling horrible. I feel amazing. And I haven't felt this good in a long time. And I pray to God that it continues. I really do. Because I'm way too young to feel as old as I've felt for the last 15 years. Way too young for that. So anyways, anything else I need to tell you? No, nothing else I need to tell you. I love you all. I hope you have a blessed day. Thanks for listening to me ramble on for 15 minutes, and I will talk to you next time. Be blessed.